Hi, in this video, I'm going to be talking about setting boundaries during breast cancer and its treatment, and frankly, afterwards. You may learn some things that will help you going forward in your life. So, what are boundaries? Boundaries are sort of an invisible line between us and the outside world. Boundaries can be physical, as in this kind of touch is acceptable or this kind of touch isn't. But more often they're interpersonal, or in terms of how we manage energy, privacy, space, and time. So why is setting boundaries important? Boundaries help us decide what's acceptable to us, and when we're really clear about our boundaries, we can communicate those to other people. This can help us be really clear about our expectations with other people and can help us decide what to do if a boundary's been crossed. So let me give you a couple examples. If, and this is whether one is going through breast cancer or not, one is in a space. We'll talk about a physical space. Imagine being a teenager and your sibling keeps coming in, and they're coming into your room without being asked. They just walk on in. They might take something, they might mess up your space, they might eavesdrop in on a conversation. And you find that you're reacting in a way that doesn't feel good because it doesn't feel good. So you might notice in your body, you tense up. You might notice in your behavior, you might snap back at somebody, you might lash out, you might throw something. Just imagine going back to when you were younger. You might shut down. So when our boundaries are crossed or violated, we react in a whole host of different ways. We feel it in our body and we react in a certain way right in the moment. We may also start avoiding the person who's crossed our boundaries or shutting them out of other parts of our life. So I'm using the example of teenagers because we've all been there, and also because it's really easy to see what a boundary is when it's our physical space. There are also people who will cross our boundaries in terms of our energy. Now, this might be because they're talking on, and we're tired, and we have a really hard time telling them that, I love talking with you, and I love that you're sharing this time and space and your stories with me. But at some point, you notice in your body again, or you notice in the way you're reacting to them, that maybe they're taking too much. Maybe they're taking more than you have to give. If you have a finite amount of energy and somebody is sapping your energy, you don't necessarily want to shut them off entirely, but you may want to set a limit. We hear a lot of talk about boundaries today, and maybe you don't like the term, so maybe you want to think about limit. I even have some people with whom I talk about boundaries as edges. So that's where one thing begins and another ends. Something's acceptable, comes up to the edge, and then all of a sudden it's not. So we've talked about a physical space, then there's also energy and time. There may be people who cross your boundary in terms of what you're comfortable talking about. So you may know what treatments are coming up, what to expect, what your prognosis is, what the purpose of therapy is, whether it's cure versus not cure, but rather managing symptoms. You may not want to share that information with everybody. In fact, it's really likely that you don't. And so we can set boundaries with the amount of information that we share. Have you ever been with somebody who keeps asking you questions and you don't even know the answer to them yourselves, and they just keep asking you stuff? And when they do that beyond what you're comfortable with, that's another boundary. So there's privacy, time, space, energy, and then of course our bodies, which falls under the space category. You may find when you go to treatment or you're in a doctor visit that the person who comes to support you keeps rubbing your back. And they're rubbing and rubbing your back, and it doesn't feel good to you. Sometimes it does, but sometimes they're also doing this to soothe themselves. And how do we convey to somebody without making them feel bad that they've crossed a boundary? Because these are often people we love and want to keep in our life. So one thing to do is to note it yourself, is to name and notice your boundaries. Maybe this has been helpful today. Time, space, energy, privacy, right? So you say, that was a boundary. Noticing that is the first step. And then talking with them about that when you're not as activated, when you're not upset, because these are very likely to be people you want to keep close, and we don't want to trigger shame in other people. So talking to them in a really unheated way, in an unheated moment, can actually be more effective in getting your boundary met without them, whoa, right? If we tell somebody we don't like something, they can recoil and actually make us feel bad. That's a reaction to their having been told they did something that didn't feel good to you. So to recap, talk with them when you've noticed and can name the boundary that's been crossed, identify the boundary, figure out what it is you would like. Talk to them when it's not a heated moment. Talk to them when you're feeling cooler and calmer. You might find it helpful to run this by somebody else first. You might say, I just want to run a conversation I need to have with a neighbor, friend, parent, partner, kid, somebody at work. And how does this sound to you? Again, you're going through something extreme, but we desire more than almost anything to stay connected to people. So running that conversation by and practicing it can be really helpful. The next thing to do is to structure the conversation in a way that talks about you. So your feelings, your needs, and then your request. So I need a little bit more physical space when I feel like somebody's hovering over me. It makes me feel anxious. My request would be that you ask me before you touch me. So I know it sounds really formal. You can practice this. It gets really good and really easy to have this conversation with more practice. What about privacy? So I notice that when you ask me questions to which I don't know the answer, I feel frightened. I feel frustrated. I feel irritated. My need is to have a little bit more privacy. My request would be that I bring up to you things regarding my treatment or my prognosis. So needs and feelings, you can make an observation, needs and feelings, and then a request. Remembering that people have the right to decline your request, and what do you do? So in the unlikely event somebody doesn't honor your request, this is where being really compassionate to yourself is really important, and recognizing that maybe this is time to release a relationship or to set an even firmer boundary. That might be, while I'm undergoing treatment, I'm not going to interact with this coworker. I'm not going to interact with this family member. You know, I've had patients this is more than one person, this is quite a few people, whose mother has said to them, how could you do this to me? As if the cancer that my patient had was doing something to the mother. You could imagine that would be somebody with whom you would need to set a boundary that says, while I'm undergoing treatment, I won't be interacting on the phone or in person with my mom. I might send a weekly email. So that's a pretty stark example of somebody where a boundary really needs to be set. So what keeps us from setting boundaries? It may just be habit. We're used to pleasing people and we take care of them more than we take care of ourselves. So we don't want to hurt their feelings. But in the meantime, our energy, time, space, privacy are being sapped. We might have fear. What will happen if I set a boundary? Will this person no longer be there for me? Will they no longer love me? That's often what sets up people pleasing. The other thing is we may be ambivalent. We may actually like some of the stuff they're doing or some parts of it or some time. It's helpful. And we're worried if we set a boundary, we won't ever get that attention, time, space, physical affection back. So we might be afraid, ambivalent, or just completely unaccustomed to setting boundaries. I've had quite a few people tell me that the breast cancer experience, going through a diagnosis and treatment for breast cancer, has been really helpful for them to learn to set boundaries, limits, or edges, whatever you'd like to call them. What's the benefit of setting boundaries? Well, I hope it's been evident that preserving your time, space, and physical comfort is really helpful, but setting boundaries is a really good way of practicing self-care. The other thing it does, if you're a parent, is it can role model setting boundaries to your kids, younger siblings. You can even role model to a parent how to set boundaries, or to other people at work. So sometimes people find it easier to learn to set boundaries because it can show other people how to do it. You can role model this for other people. So that might be a way to sort of ease on into it. I hope it's been helpful. We covered what boundaries are, other names for boundaries, the different types of boundaries, different ways of doing it, how to respect our own boundaries and feel those in our body, and then some language for how to convey those to other people, as well as some things to do if people refuse to accept our boundaries. If this has been helpful, click like and subscribe. Don't forget to go to yerbba.com for your personalized report. And as always, you can drop a comment or a question below.